Hey, my medical coding family, how's everybody doing today? You guys let me know if you guys can hear me and if there's any echoing. Yeah, you guys can hear me? Yay, good. All right, let me pick a scene. Let me make sure I got it set up here for you guys. Working on notes as usual. Move this out of the way. And let me have video kind of on top, I think. That's what we need to do. And over there, if we use it. Out of the way. Oops. Where did OBS go to? There we go. And click that. Move you guys so you guys can see on TikTok. Hey, Amora, how are you doing? So good to see you. Thank you for all the TikTok gifts. Oh, that's awesome. All right, I got E&M practice questions for you guys today. Let's see, why does it look so kind of foggy? Let me clean my camera. Sorry, guys. Let me clean these cameras. Let me see if that'll help. Where are they? Clean these cameras. Boy, they look so foggy. All right. All right. I am streaming live on YouTube also. So if anybody wants to switch over there, there is a bit clearer, hopefully, screen on that. How's everybody's doing? Happy Monday. Happy Monday. See if I can't get this to look a little better on TikTok. I don't know. I'm just seeing if I can't get it to look a little better for you guys. I don't know. Oh, I hate that stupid little thing that comes up. Hold on, let me get this out of the way. And yes, I don't want that to be in the way of the practice questions. There we go. There we go. Does that look a little bit better? Oh, what have we got? Oops. I got a B as for the answer here on TikTok. Let's see what you guys are saying on YouTube. I know I'm supposed to say tuba the U in that message. Thank you, Go Cart. How's everybody doing today? Hey, Carla. Good to see you. Tarantino, how are you doing? Thank you guys for all the best wishes for Travi. Hypertension, and they were prescribed medicines. This would be B, which is our stable chronic illness. Good job. Okay. What about this one? You take your exam, Bluey, on Thursday? Oh, today's the time to cram, huh? Oh, yeah. Practice as many practice questions as you can find. Get a strategy down, right? A plan of attack. Every section of the exam should have a different plan of attack by the when you look at the available answers, what's your plan of attack, right? Integumentary, you have a plan of attack. Cardiovascular, plan of attack. Looking at those available answers, and you have a plan, a set pattern of how you answer the questions based off the available answers in front of you. You've done so many practice questions that you know what to do for each section. It gives you a step-by-step kind of like pattern of things to do, right? E&M, we don't do the process of elimination, right? We look at each available answer, right? Even if it's a number, right? And we have to think about its header. What are the guidelines to get patient status inside that header? To be in the ER, you don't physically have to be in the ER, right? Just like if you're admitted to the hospital, admit hospital, your 99221, you don't physically have to be upstairs in room 2048, right? You could be somewhere else in that hospital. It's not a physical location, it's provider status. What does the provider consider that patient, right? You need to have a plan of attack. But process of elimination works for all the other chapters, from integumentary all the way through the medicine section. Of course, looking for similarities in your answers. If your answers have the same code listed twice or something only one number apart, then there is a reason for that. They want to know if you know whatever that little difference is, for sure. You can only stay on for half an hour. I'm so sorry. Tarantino, I'm so sorry. Yes, the exam does have a calculator. Do I recommend using it? If you must, you have 120 seconds per question. You cannot imagine how fast that is per question. By the time you go hunt down your calculator, key in information, you know how many seconds have gone by? Please do as much in your head as you can. What do you guys think is the answer for this one? Everybody saying D? It is D. Good job. Here's your next one. Hey, Kanisha. How you doing, love? Do you recommend What do you recommend for each chapter as a plan of attack? Ooh, I need to make a video for that. I do. I need to make a video for that. Since we're doing E&M today, I could talk a little bit about E&M plan of attack, right? If you're on YouTube, you can see the video, like my desktop computer, because I got a video screen up. But what I'm talking about, plan of attack for E&M, E&M has a lot of codes in it that are in the 99 range, and one of the crazy parts is a lot of the codes are out of sequence. They're all over the place. Even the ones that are in numerical order are really pushed up out of the way and are not where they should be. So, number one, you have to practice finding your E&M codes. Even if you threw every E&M code there is in the CPT book and put it in a randomizer, right? And had that randomizer pull up a new code every 30 seconds, can you even get to the codes? Can you find it? I can't tell you how many people have failed the exam, then booked my session for a tutoring session and want me to see if they're ready for the exam. And one of the first things that I notice is they can't even find codes. If you haven't practiced enough to where you've got muscle memory and you know where codes are at, then I can't even begin to help you with guidelines and other strategies, right? You have to have at least know where to find the codes are at, where the codes are. Be sure you've gone through, and this will help a little bit in E&M, but technically not really. Go through and add the page numbers down next to each red code in your CPT book from E&M all the way back to medicine. The fastest way to do this is every time you run across a code that has a hashtag in front of it, then you know that it is out of sequence and you found it in its place where it's been put. It's easier to go find it in the place where it should be because that is at least in numerical order. You can run to the code where it should be after you found it when it's a hashtag. Put down the page number where you found it and where it should be. And then I always underline it in red when I do add that page number to the place where it should be. That way, if I ever find a hashtag that isn't underlined, I know that I never found it and put the page number down. So anyway, that's, but in E&M, it's so messed up, truly, that even having the page numbers down where they should be, some of the codes are not in numerical order here. They're back in medicine. So even trying to find these in the E&M section when the red codes aren't even where they should be because they're in the back in the medicine section. Okay, so it's a nightmare. It really is. Please, please, please see if you can't. I need to build one of these on my website, is a randomizer that will bring up E&M codes without the descriptions, and then you need to just practice running to them and finding them because this section is all messed up. The front red section in the front of your E&M book. And you need to practice and have muscle memory and finding the codes. That's one plan of attack. But during the exam, what you need to do is look at these pages in the front of your book, right? You've got page 1 through 3, and you need to look at every available answer. If it's a question that is all numbers, right? And you need to look at your headers for each available answer. If one of your answers is an outpatient office visit, one of them is a hospitalization inpatient code, then you'll have another one where answer C is critical care services, and then you'll have another one where answer D is an emergency room visit. You need to know in your head what is the criteria to get that patient that status in the ER, in the admit patient, if they're in an office visit situation, or if they're just simply an observation. You need to know by heart what criteria or words that you would look through in the exam question that puts them in a regular office visit or in a regular ER visit, or a regular admit hospitalization or observation or ER visit. And that takes time and it takes practice. Who's passing? Yolanda. She took her exam yesterday. Question was very similar to a question that I encountered. Also noticed what is not question, which you advised on the previous live. Yep. Ooh. Yay. Our last Monday's live has a question that is very similar or almost exact as what is on the certification exam. That is super cool. And that replay is available. I'm trying to do something and it's just not working. I'm trying to screenshot her passing. Yay! But yeah, I need to do a video and some handouts on plans of attack. Like, you need to have that routine ready in your head. I need to do that. That's been stewing in the back of my head uh, about something that I need to do. And then this week with poor Travis having surgery all of a sudden has me all messed up. All messed up. That's so cool, Yolanda. That's awesome. Janelle's asking for what tips can you use to pass? Everybody's saying B for Fred. Where is Fred? Right? Just because he saw an ER doctor doesn't mean he's in the ER. Those types of things, right? Um, it just, you have to be careful about word searching and picking out words here. It could be that that's where he's at, but you need to consider, what does the provider consider this patient? Yes, they're being seen in the ER, but does the patient have to stay there and wait a little bit, like they're wanting to observe something, reevaluate after some time, maybe give an injection or a Benadryl or something? If the patient can't leave, then you know they're no longer in the ER, right? Physically they are, but provider status for their patient is what's most important. I'm not saying that that's going on in this question, but that's why E&M is so challenging. You can't do it with a lot of um, shortcuts, right? You have to evaluate what the provider thinks or their plan was, or why they ordered certain tests or did certain things to come up with a decision for E&M. It's a little bit different of a section for sure. We only have 6 questions in this area. We probably will need a little bit more time for this area, but we can use the process of elimination, looking for similarities in other areas. One trick that I do know is that most likely you will never have a patient who qualifies for a consultation, either inpatient or outpatient. Try not to ever pick that answer. It would be extremely rare if you saw that and it's a correct answer for the certification exam. A lot of times that available answer is going to be available for you and it's there, right? But if you're going to pick it, you must see the lovely 3 R's, right? A request, the rendering of that request, and then a report back to the provider saying, here it's done, and this is my suggestion. There would be no treatment done on the patient. If that doctor treated that patient, wrote the prescription, did something to that patient, ordered tests to be done, then that's not a consultation, right? That's treating a patient. A consultation just means I want you to give me some advice on this patient, on this one little condition. Don't touch my patient, besides evaluating their medical records and maybe listening to their bowel sounds and looking over their blood pressure and that kind of stuff. I mean, they will, physically see them maybe, but it doesn't mean that they treated them. So be very, very careful about that. To out of code sequences, that's very helpful. Yeah. What helped? I watched all Jen's lives, and AAPC practice exams helped too. Yes. You don't want to get practice exam questions from somebody who didn't write your certification exam, right? The people that wrote your certification exam, that's who you get. their practice exam questions for. Those are most helpful, most beneficial for sure. Oh, thank you so much, Yolanda, saying that I made a difference in your life, made it your certification exam easier for you. That is wonderful. I'm so grateful that you put some trust in me and watched my nightmare of long videos of me yelling at the kids or talking to the cats or getting off topic or ADHD fever nightmare that I am. I hope I'm so glad that you found something in there that was helpful that helped for sure. What about this question? What do you guys think on TikTok? What do you guys think the answer is? Hey, Twinkle. Good to see you. Thank you so much, guys. So nice to see. We got 71 people on TikTok. Oh my goodness. 39 on YouTube of the U. Are you going to go for another certification? It's always cool to have two. I know you are exhausted and don't ever want to look at another CPT book, but while you're on a roll, I'll squeeze that in there. Just not that I'm trying to sell you anything at all, but to make yourself look really good for employers and stuff. But hopefully you've already got a foot in the door, and this will just help you get a promotion. But if you don't have a foot in the door and you're looking to get hired, it's always good to have two certifications. I'm currently making 80% on the test bundles from AAPC. Things I miss, I just don't have enough time. You've got to get faster. Yes, you got to get faster. I prefer you to get up in the 90s on taking those CPC practice exam questions. When you're taking those exams, 90% is better than 80% for me. What do you guys think on this one? For our hypertension patient who is not at goal, what do they consider this patient? Thank you for sharing the live. So we're going to put these E&M numbers into a randomizer, and then you guys are going to try to run to the codes as fast as you can. Practice doing that. You need some muscle memory. Be sure when you're doing practice exam questions, this one's B also. I think everybody got that one right. When you're looking at the correct answer and they're giving you the rationale, I want you to go back and look in your manuals. What in the book tells you that each wrong answer is wrong? Are you under a wrong green header, right? Are you under the wrong red header? And these chapter header pages that are right before every single chapter, even in tegumentary, musculoskeletal, cardiovascular, they all have it. They group the codes together and then they tell you the header. Practice your practice questions with these. Look at your different available answers. Are you in newborn services? Are you in the birthing center? What is your patient status? Are you in intensive care? Where are you? This is super helpful. This will help you get the correct answer and to see why the wrong answers are wrong. Was that answer under the wrong body part? Especially in muscular skeletal when you're over here. A lot of times they will give you the same excision, but in different body parts. You'll get one excision, another excision, and another excision. They'll just be separated by different body parts, but you won't see it inside here because you're so hyper focused on the code and its description that you're not looking back at the red headers for the body parts or the green headers dividing up different types of surgeries. So please start trying to do your practice exam questions by looking at these pages first instead of running to the CPT codes and their descriptors first. That will help you guys learn how to use the books. Don't add any tabs or anything into your book. Those are just handicaps and they slow you down when you could be practicing your understanding of the book. What do you guys think is the answer from this? Hey, Katie, I'm so glad you're here. I hope I can help you out. What do you guys think is the available answer for this one? Whoops, sorry. I clicked out of OBS again. Here we go. Just trying to make it to where the red line wasn't showing up again. Hey, Bill, how's it going? Everybody got Appendix D for this one? Don't forget, if you've got AAPC's Hip Picks book, Appendix C is really cool because it's a bunch of acronyms that they use, and AAPC loves acronyms on the exam. Is the AAPC CPC exam review helpful? Janelle, I would love to know. I want to be able to do that 8-hour course too. When I talk to AAPC, I have like a teacher manager person. I'm going to ask them and see if they can't add that course to my system, or I'm just going to purchase it because I have no idea what's in it, but it sounds cool. It's an 8-hour self guided course that does, from the exam point of view, AAPC's review, right? Like of of the of the exam. They gave me the ability to let people purchase it from me, and I'm using my teacher discount so that you guys can get it cheaper than even you can get it on AAPC's website, which is cool. But I don't know what's in it, but I would love to know what's in it. That's cool. I'm going to ask. I am losing my mind, Bill. Losing my mind. I got 3 sons, and I've got them all, about raised, one in their 30s and two 16-year-olds, and they haven't even had stitches. I've kept very healthy babies. They don't miss any days of school at all. They attend and they go, and they're healthy and active, and very proud of that. Um, until now, I've got one that missed a whole week of school. The whole school thought he was DOA, and now he's missing an organ. So that's traumatic. I am losing my mind. Never good when your kids are sick, but of course he is like happy and taking this a whole lot better than I did. He's like, it's okay, Mom. Let me go to school. I want to go to school. I'm like, driving me nuts. Hey, Deborah, how are you doing? So good to see you. What do you guys think? Is this a new patient, established patient, an office visit, or an inpatient consultation? What do you guys think? We got 100 on TikTok. What do you guys think is the correct header or patient status for this patient? Thanks, Tarantino. She said, Jen, you probably teach your students more than this in the review. I just barely started teaching the CPC course from AAPC's course, right? I have the course from AAPC, and people can purchase it and have me teach it for them and to them. Um, I had 5 in my first class. Um, one has taken the exam and never saw the exam before and never took it before. And he made a 97 on the certification exam the first time he took it. I'm super proud of that. That's awesome. We did an accelerated class we did 2 chapters per week, and he did great. Did awesome. Now I just need Twinkle and the rest of her class to finish up the course and take their certification exam and do just as well. It has modules in there: compliance guidelines, HIPPICS, ICD-10, and all the CPT sections. Gotta go. Good night, Tarantino. See you later. Thanks for popping in. I've noticed that you bring up HIPPICS. There's not enough courses or per se education. Yeah, HIPPICS, though, it's only 3 questions on the certification exam, so it's low on the totem pole when all the other sections either have 7 or 6 questions in them. So we kind of leave HIPPICS to fend for itself a lot of times. No worries, no worries. I'm awful at typing. Ooh, 110 on TikTok. Everybody got their answer picked? Answer A. I didn't see a lot of answers A on this one. So let's talk about it. For this one, when it asks us, an E&M code would be selected in what subcategory for the cardiologist? What did the cardiologist do? The cardiologist was asked by the PCP, right? To manage the patient's cardiovascular failure. So that cardiologist is treating that patient for that condition. That means it is not a consultation. Remember, guys, consultation is just advice, guys. It does not mean that we are seeing them as far as treating them. We're not ordering any test. We're not treating the patient. We would have asked or told the PCP to do a test, a stress test, or whatever. Yeah, we would have not done any of this. If we are going to manage and treat a patient, then that means they are our patient. That means it's new patient. So 100%, I would say 99% of the time, any questions asked about whether a patient is here for consultation, most of the time it is never a consultation. There's a trick, right? Remember, render, request, right? And report back. Without treatment, there is no treatment, no prescriptions, no managing. None of that is part of a consultation ever. Consultation is just advice. It says schedule a stress test for this new patient. There was a report that did get sent back to the PCP, of course, of the results of the stress test. See, they did the stress test. But it also says the cardiologist examines the patient, discusses treatment options, schedules a stress test for the new patient. Ah, I see what you're saying. Yeah. So it does tell you right there that they are a new patient. Yes, yes, yes. But anytime anybody says anything about transferring a condition or a patient, total health care, or any part of their health care to another physician and make that condition their responsibility, they're a new patient. They are not a consultation. All right, guys, let's try this one. What do you guys think about this one? I do have a new CPC course. If anybody's looking to get the 2026 books, textbooks, and course, AAPC is already letting me order those and send those out to new students. So y'all can start doing that right away. I have the same course that is on AAPC's website. It's their course on my website. I just use my teacher discount for you guys. You do get the books, the textbooks, and everything mailed to you. It will be the 2026 version, and then you can start your self-paced course with or without me. And then you can join in on my course lessons whenever you want to. Right now I'm on chapter 14 of 21 chapters. I should be done with this round of lessons by January. So we'll start over with the business of medicine, chapter 1 again, and I'll reteach it again. If anybody wants to join in, I'll be starting over again in January, and it might be the last time I teach this course. I don't know if I'll renew it again and purchase the license again. We'll see. It's just really hard to compete when a lot of times AAPC has not cheaper options, just better options. Mine is the cheapest, but it only comes with 2 exam attempts. Multiple times this year, AAPC was giving away the same course for a little bit more money, but with unlimited exam attempts, which is a really cool deal. I wish, I could give away that. That would be awesome. So if they're not going to offer that to us educators, then there's no real need. Y'all can just purchase the course with the unlimited exam attempts from them, and then take the exam as many times as you need, right? That's craziness. So it's just really a huge expense, because you know the licensing fee is like several thousands of dollars, and then each student cost me several thousands per student to enroll them. So it's huge, and I can just teach maybe not the course, AAPC's course, but from my own point of view, from the certification exam point of view, instead of teaching you guys how to medically code, I guess. I don't know. It would be nice to have an EHR system that you guys could learn how to medically code inside of a real electronic patient chart, and learn how to verify insurance and check to see if modifiers go with that group number and plan number, instead of doing it all paper. That's kind of crazy, because it's not really going to prepare you for what you're going to face in the real life world out there, because it's all different and not paper. But we'll see. We'll see. But for now, I'll have the license agreement till April of next year. And if I can help you guys in any way, if you want me as your teacher, I'll have it and can teach you guys. You'll also get a copy of all my notes, and you get access to all of the workshops and classes and videos galore. This one for our UTI. What do you guys think is the answer? I got some B's, C's, and A's. What do you guys think? Lisa Moss says experience. Yeah, I would love to be able to do that. I passed mine 8 years ago and still can't. Oh, goodness. Lisa, is your social media wiped clean, right? You hired somebody to scrub the internet and make sure that every Facebook post, um, every TikTok, everything is just rainbows and sunshine, right? You've made sure that absolutely nothing can come back to a company that looks you up and sees anything negative, right? Um, you want to make sure there's no bad reviews for other companies, even though you're in a right to do that, right? But, if you've called somebody, you know, that they denied you service because of racism or something crazy and there was controversy around it, employers look at all that now. So make sure your social media is pleasant, right? Make sure when you're interviewing and sending out resumes, your email address, right, has your name and your certification on it, not Betty Boops goes to the zoo at gmail.com, right? You want to make sure it's professional. Have you looked at Project Resume, who they are CPCs people who will redo your LinkedIn? They'll redo your resume and write you a cover letter from a CPC point of view. I have a meeting with the owner of the company the 24th of this month, and I'm going to add that to my course so that everybody that has my course gets that service too. This one was C. Here's your next one. Make sure that you're networking with AAPC. Are you attending AAPC meetings? Does your president know who you are? Are you applying for jobs that are posted onto their board? Um, are you changing your resume every time you apply to mirror what that employer is looking for? And there is a million jobs that you guys can get that don't require a CPC, but will get your foot in the medical door so that when you do pass, you can transition into a CPC job as a step up, right? I have a blog on my website. It's totally free. It's under the resources tab at medicalcodingbyjen.com. And if you guys go there, second to the last blog is a huge post of like 100 jobs that you guys could get right now. Also, Miss Moss, have you gone to the CMS website and done the fraud and abuse training that is free certification from CMS, added that to your resume so that all employers know that you've already had that training and they won't have to do that once you get employed to them, right? Every employer, even mine in California, would send me there to do the CMS training so that I can have access to patient charts. If you already have it done and you're already certified through CMS to have access to patient charts, by doing those 2 completely free courses and getting those certifications and adding them to your resume, then they know that they don't have to pay for your time to go do that training once you're hired. There's also some free certifications on there for grievances and appeals and the world of Medicare. If you did those certifications, which are totally free, you could get a job tomorrow doing grievances and appeals in the billing department. There is no way somebody couldn't jump in there and get a job like that with a CPC and those certifications, even if it's a CPCA. Don't forget that AAPC will take any medical background at all and count that towards getting rid of your apprenticeship. Let's say you're a front desk receptionist, you're checking in patients, you're handling, giving them their lab recs to LabCorp, your back office medical assistant. all that can be counted towards getting rid of your apprenticeship, because if you're front office, you're keying in patients' insurance, scanning ID cards, all the stuff that's required knowledge for a CPC, right? They'll also accept back office medical assistants, right? If you work in a lab and you've dealt with ordering CPT codes because that's tied to a lab rec, they will count that. Um, don't forget, you can get rid of your apprenticeship for a lot of side quest jobs too. So, why was the UTI moderate? Didn't we write a prescription, Miss Beale? Right? If you write a prescription for a patient to help them get rid of a condition, right? That risk goes way up for any prescription drug management. And that's all we were asked about. We weren't asked overall problem list or data. We were only asked to evaluate the risk of this patient. And any prescriptions written, even if we told them over the counter medicine to take, that is a moderate. Always. There you go. Next question. Be sure your AAPC president knows you. Be sure you are reading, Miss Moss, those AAPC magazines that you get in the mail, right? Because if you were reading those magazines, right, one of our next to last magazines was a call to action from this lady, Miss Kimberly. She's on LinkedIn. She begged for you guys to please find her on LinkedIn. She has job opportunities with the federal government, right? If you're scouring your monthly magazine, there's job opportunities left and right in here. They're telling you where to go for your jobs, right? Miss Kimberly, right here, is head of the IDR program from the federal government. It's a process that we just enacted in law in 2022. The system isn't even developed yet, but we're still supposed to have had started this program. And it's a way that medical offices or hospitals can find an arbitrary decision for payment, right? So health plans will send a payment to a hospital and the hospital disagrees with that payment. There's nobody to ask, hey, look at this, this is wrong. You can take them to civil court, but that's going to take you forever. So we made a federal program that's non supposed to be whatever, um, neutral, right? And this is going on right now. We need people to run the IDR program. Have you looked for a position as a federal IDR processor? That position opens up the door for all CPCs, right? So if you're not going through this magazine monthly, looking at every single page where somebody wrote the article and then looking at their jobs that they had, and looking at their jobs that they had and seeing what they are doing, they also go through and talk about all types of positions and where the field is going, and how to communicate better as a professional, how to get that job. There is a ton of information inside your monthly magazine that will definitely help you guys out. And every one of these people that are here and they have an article about, you can see where they worked and what the name of their positions were, because you won't find most of our areas where we can get employed under just CPC. You don't go hunt for that job. You go look for the IDRs, the HEDIS auditors, the risk adjusters. There's a ton of different names that you call CPCers that are different from just CPC, right? You'll look at compliant analysis. You can do that. You can do all kinds of different positions. You just need to know what names to look up as far as the jobs, right? And this magazine definitely will help you out. I love reading where all the people have been and what they do now and what positions they hold. Just look at the AMA CPT book, right? Who wrote this book? It's not authors, it's CPCers, right? Have you gone to the AMA website and looked at their positions that they have open? All these positions and all these people that contribute to making and creating CPT codes are all CPCers, right? I bet their job title don't say CPC with the AMA. I bet it says something else. But you just got to research all the different types of fields and positions that you can get into. And I do have a list inside my blog, probably about 10 blogs back, of a full list of a ton of different names of jobs that we qualify for. So you can check that out too on the AAPC, on medicalcodingbyjen.com too. Anyway, back to this question. Where is our patient if they are at a psychiatric residential treatment center? What would that be called? That is our nursing facility, right? Yeah, Bill, or I was talking about this lady had passed her certification exam several months or years. I can't remember what she said, but she was having trouble finding a job. And so I'm like, here's you some suggestions. So this lady's name is Kimberly Thomas. Kimberly Thomas. She said go find her on LinkedIn. They did and really good for for Miss Moss too. There was every 2 weeks, AAPC has a coffee hour, social hour. They invited her 4 weeks ago on the social hour, and she came on and actually talked about her job and her role and what she needed and what's needed. And that's where I remember seeing her in the magazine too. So that's where she said, come find her on LinkedIn and she'd be happy to help anybody try to find a position. But Kimberly Thomas, and she is an AAS, CPB, and a CPC. And she's on LinkedIn and she talks about her position as an IDR processor. I'm not sure, but it's just being an arbitrary between what is paid and what should be paid, that kind of stuff. They don't have all the information. Like CMS was supposed to key in the prices for all the codes um, of what should be paid per year, right? It changes per year. And they're supposed to have all that information, all the guidelines keyed in by now so that the arbitrators can look at that information and see if it's valid for that year and for that. Anyway, but they don't even have all that created yet. So they got some work that needs to be done. But the medical field is always changing, always updating, always evolving. You can't stay in the little mindset of just CPC and that's all I do is CPC. There are going to be a ton of different names and positions for you guys for sure in the medical field. And every industry calls their positions that they have open something different. Um, I don't know of any really that just say you're hired and the name of your position is CPC, right? It's always something different. There's either a client specialist or I don't know. They come up with all these little fancy terms for things. Super funny. But hopefully that is helpful for you guys. Make sure that when you're emailing companies and stuff like that, that you've got a nice email address for them to email back. Phone numbers, bullet points of your tasks that you can do or accomplishments. They want something quick that they can look at. They don't need to know, your mailing address. You can get rid of that on your resume. Um, they don't need the month and city where positions were held, right? You just need the year of employment, right? And the position that you held there. There's a lot of things that you can slim down on those resumes that make them better for people to stop and look at them. So be sure to follow people on TikTok, watch tons of YouTube videos, and when you practice interviewing, be sure you've run around your house and talked to the walls and answered questions like the wall in your house was interviewing you, right? I know when I'm teaching a new subject that getting the words out of my brain, out my mouth, is a challenge. But as I reteach it and reteach it and reteach it, by the sixth, seventh time I've taught it, then the words start flowing in a good cadence and a good pattern out my mouth, right? First couple of times, it's hard for people to follow what I'm saying. It's hard for me to even understand what I'm saying because I'm pausing. Um, it's just rough, right? So make sure that you have practiced interviewing with your cat, with your family members. Make sure that you can answer those questions in a normal, natural pattern where you're not having to get the unfamiliar group of sentences that you've never said before out your mouth. Interviewing, yeah, you got to practice for sure. This question for Dr. B, what are we billing? We're billing A, right? I think most everybody got that one right. Let me know if you got problems with it. What about this modifier question? I know everybody knows this one. Yes, my name is my email address. Yes. And make sure your resume is not saved and uploaded as resume, right? If they've asked you to attach a resume or reference, it's not labeled as a document as the word resume. It should be your name, right? With your title. Sorry, TikTok's want me to do the puzzle and I can't do it. There we go. Your resume should be saved on your computer as Sally Jones, AA, comma CPC, right? It should say your name and your initials that come after your whatever, right? So don't just have it as just your name. Be sure it's labeled as CPC, or even if you have like um, a previous job, like, you know, Jen Brewer, quality program specialist, data analyst, CPC, you know, something, because, that lights up when they see it too. You don't have to list every qualifications, but you can list your job title that you currently have, right? But at least do your certification titles, right? Save your resume as your name and your title. Everybody knows that one is mandated, is B for sure. All right, what do you guys think about this one? Look at your available answers first. If you're already reading the question, you're doing it wrong. Come here. Are they a new patient? Are they established patient? Is this a consultation? Then you read your last sentences down here. Don't read anything else. Dr. Smith also included his findings from the encounter. what E&M code would be reported? What does the last sentence clue you in as to what you're going to be billing? What differences do you need to look for in your exam question to decide whether you're in A and B bucket versus C and D bucket? Because those are two different header buckets, right? Our buckets are those pages. These are our buckets. What's the difference between classifying a patient as new or established or consultation? Got to think about those guidelines. Let me know on TikTok if I missed your question. The tappy taps are going like crazy. Why is it modifier 32? Why is modifier 32? 32, okay. So if we look at modifier 32 on the sidebar of our book right here, we've got 32 is mandated services. And inside of our exam question for our previous one, right, it says mandated, a service that is mandated. So the modifier for mandated service is 32. Court appointed, court ordered, still mandated. Insurance companies can mandate second opinions, so can the court. So yes, B is correct. Now on this one, hopefully that helps you out, Katie. A freeze in place for coders. What does that mean? I work in healthcare operations. Of course, Barbara. You can email me anything. Medical coding by jen@gmail.com. She said, I don't know this one. Do we have a request from one doctor to another doctor? Do we have that request being done? And do we have a letter sent back saying, here's our findings and what we suggest? If we do, then we can bill for consultation. Oops. I can't get the. Hey, Jess, you emailed me about the CPMA. Oh, exciting, girl. Jess was one of my very first I helped pass back in 2019, 20. So good to see you getting your CPMA. That would be so exciting. Everybody got D as their answer for this one? All right. What about this one? Are we a regular patient or an established patient? Curly, thanks for sharing the live. Summer, thanks for the follow. Yeah, if you can't read the entire question, I'm sorry. I am streaming this through my freaking cell phone because TikTok won't let me stream on two. They just won't let you stream. Tube of the U and it at the same time, so I have to use a freaking cell phone on a computer screen. But I am streaming this on Tube of the U. If you can't see it very well, it's a much better view over there. The answer was D. Okay. What do you guys think about this one? There you guys are. Can we go over the one for the consultation? Yes. We can go over the previous one, sure. So, do we have our 3 R's, right? We have patient sees Dr. Smith for a consult at the request of the PCP. So we have one of our 3 R's right there, request. Did the patient go and see this patient? The patient did see Dr. Smith, and Dr. Smith does perform a medically appropriate history and exam, discusses the options for allergy management. The patient agrees that they would like to be tested so that they can gain better control over their allergies. So it was rendered, and we've got the request. Now, Dr. Smith didn't do anything to the patient, just talked about those options with that patient, right? And then sends a letter or report back to the PCP, letting them know their findings of the visit. So, wrote a letter back to the PCP stating their suggestions that we send this patient to go get allergy testing, and then it'll be up to the PCP to agree or deny it. But it looks like we have all 3 R's: request, rendering, and the report. They actually have report in here, they have request in here, and then they have the word performs. Sort of close. They got close to letting you guys see all 3 R's physically in the question, but that is all 3 R's. So we know we get to bill a consultation, right? So then we just, based off of our office visit, do we bill a 42 or a 43? $42 is straightforward. 43 is low level. So if we look at our data sheet, thingy that's on 10 or 11, we look at straightforward, they would have seen the patient for something that's a self-limited minor problem. Under low, we could have a chronic problem, right? A chronic illness, which this patient has. So number 1, your problem list only falls under low. Data, is there any data? No data. Data would have been minimal. And then the risk. If we send this patient for diagnostic testing, which is located right here in the risk, and possible treatment, then we could be a low right here too for allergy testing, because we're going to make the patient really sick when we do that. They're going to flare up, So we do have a low with this one. So you can bill your 43, which is a D. Does that help? And also, let's see what AAPC says. See if I got it right. So their problem list, they did say it was a chronic illness. No data, minimal. And then risk of management allergy testing, they did say it was low. So 2 lows you need to match, right? 2 of these 3 you need to match. That means your lows do match. They say their problem list was a moderate. I say it was a low, but they're saying it's exasperated, which makes it a moderate for the problem list, but I got low. But anyway, we got a low here and a low with risk. Having 2 lows makes it a low. Yep, yep, yep. You're welcome. You're welcome. Just don't know if there was enough in here about it being exasperated. I guess it says ongoing with allergies. They failed 2 meds. Symptoms continue to worsen. There we go. It is exasperated. I should have paid attention to that. So they're right. That is moderate. It's okay. It gets knocked down to a low because there is no other moderate, no moderate data and no moderate risk with that one. Although allergy testing could be considered moderate. I mean, you're going to make them sick, and you know they're going to write a prescription after that, but we'll get there. All right, what about this one? We've got this one where we got to figure out if our patient is new or established because we have 2 buckets of E&M codes. 2 answers are under one header and 2 answers are under another header as far as E&M codes are. So figure that out first. That gets you down to 50-50 shot, and then figure out if you're moderate high or straightforward low. Ooh, I missed 99 messages. We went over the last one. I hope that was helpful on TikTok too. Hi, I'm looking to try something a little different. I've been a phlebotomist for 30 years. Awesome, Jimmy. That's awesome. I used to draw blood um, and shoot x-rays and deliver babies. I've done all kinds of stuff in medicine too. So that's awesome. Used to run a lab in Memphis, Tennessee. Long old time ago. Used to be quite good at being a vampire. Loved it. There's nothing like getting one-on-one with a patient while you're drawing blood. Sometimes you even spend more time getting to know the patient than the providers do. You really get to know your patients. It's really nice to work in a lab, drawing blood. It's kind of nice, especially when there's only one chair and it's just you and that one patient and there's nobody else. Now they have like a whole row of people drawing blood, and you got to be quiet, and but it was nice back in the day. You could really get to know your patients, but um absolutely, you'd be really good at medical coding, and you could get your apprenticeship taken off right away before you even took your certification exam because you have 30 years of drawing blood, right? You filled out lab recs for LabCorp and all those places, right? You picked CPT codes, and based off of orders from physicians, you handled codes, you drew right blood for what CPT codes, you understand what blood is being done or tests are being done based off the tube colors, and that's all relative to the CPT codes. So you could absolutely start out already without being an apprentice. You would be a full CPC with that kind of history. All you need to do is pass the exam. What are the 3 R's? The 3 R's are render, request, and report. They are listed in your E&M guidelines under consultations. Where's that at? It is in here somewhere. And I moved everything. I'm in the 2026 book, so I'm like all over the place. I don't know where things are at yet because we've moved some stuff around for the new codes we had added. Just 2 this year. Not too bad. Right. Yep. Under consultations. So page 40, but I'm in the 2026. We're going to have some. Yep. We got to have a request. We got to have a written or verbal request. And then we got to have the rendering and then a report back for the consultation. So there's an explanation of it on page 41 if you have the 2026 book. What do you guys think is the answer for this one? Medical terminology, of course, yes. Good job, Kelly. You too, Miss K. Good job. Y'all helping out answering questions when I don't see them. Good job. If you're going back the following week, that's a quick follow-up. Yes, and remember, you cannot count tests that you ordered last office visit. When you bring the patient back in and you review those test results, those are not counted in the today's office visit. If you ordered them last week, then that counted towards your E&M visit last week. And what's counted is you ordering the test, reviewing the test results, and being responsible for them for that patient. That's all included in last week's office visit. Just because you see them today and you go over the test results doesn't mean you get to bill that as data again. That's double billing and that's fraud. So be careful with that one. Everybody know that the answer for this question is B. We've got an established patient, right? Just because they're seeing another doctor who might be out of town or whatever, but the same specialty, no big deal. And then it says right there, it's high complexity. Even just seeing that, you know our only answer with high complexity in it is the 15. This is moderate complexity, the 4 is. The 3 is a low complexity, and the 2 is a straightforward complexity. So just even looking at that one sentence, you know right away your answer is B. I know all that with my background too. I just didn't use the same codes in veterinary meds, but I can tell you every tube and what they were used for. Oh, extensive procedures in the emergency room. Vet medicine has to qualify. That has to qualify to get you a full CPC. You're in medicine. You're still dealing with medical billing and coding and billing patients and mamas and, you know what I'm saying. You can't bill the patients themselves, but their parents. I've had a veterinarian herself leave and become a medical coder. I remember I have a vet who's actually a medical coder now. She just wanted to do something part time, remote from home, and she's a physician, but she does medical auditing now from home, remote. Because she can't get out and handle the animals anymore, you know, arthritis or whatever. But she can evaluate patient charts on computer screen. Yeah. Thank you for the heart me's. I switched to YouTube and it's 10 times better guarding the view. I know, right? It sure is. And I'm fixing to give away some gifts on YouTube. If you guys are on Tube of the U, I'm fixing to give away 5 memberships to my bonus material that is available on YouTube. I've already started book prepping, so like for the 2026. So any of my book prep videos that I've done are already up on YouTube, and to have access to those, you need my YouTube membership. And that ranges from like $4 a month on up, depending on whatever you want to contribute. But I'm going to give away 5 free. So let's gift out some memberships. Send YouTube some money on the credit card, and it will pick out the winners. I don't have any access to pick out winners, but whoever's usually commenting in chat, it will pick 5 winners. So we've got who winning? Who we got winning? There we go. I just gave away 5 memberships, and Sam, I've seen you win before. Congratulations. Let's Kids Play podcast. Lovely. Lizzo, I think you've won but once before too. Good. So glad you won. That's my salty mermaid. She has helped people in my Discord group. Um, I think it was Pocket Prep or something. What did you help with on Discord? You've been a vital support for something. And then Cindy, congratulations. I hope those YouTube memberships help you guys out. You got access to all my old workshops, our duck classes that are older than 30 days, all that stuff. Salty's been around a while. I remember her. I can't work in public. I have auditory processing disorder. I I think I do too. I They tested me in second grade or something. I did first grade twice. They tested me. You pull me out of the classroom one on one with a teacher, and I could score far above, anybody else. But you put me in a classroom full of other kids, I'm too worried about everybody else to do my own work. So they just called me lazy. But I failed first grade. So, I did it twice. It still didn't do any good. All my grades were always a C or D if I'm in a group of people. I cannot function that way, but I function wonderfully on my own. You separate me from everybody else, and I can perform really well that way. So I know the feeling. Do I need to remember all the medical terms? The medical terms in the book are here. Your certification exam is open book, right? So any medical terms you need to know are in your manuals. The differences between the CPT codes will be medical terms, but they're listed in your manuals with the definitions, right? Like ISO, MAL, any of your terms, meta, peri, retro, trans, epi, endo. These are the differences between your CPT codes. These words will be in your CPT book. So I'm here showing stuff off in your books. So they have pages that list out the definitions that you need to know for the different parts of your book. As long as you know where these definitions are and you can run to them fast enough, you have muscle memory, then you're fine. Even your ICD-10 book, if you get AAPC version before you do any section of the ICD-10 book, right? we're going to have your guidelines listed for you. We're also going to have all your anatomy terms for that section, body part, and then most common diseases of that anatomy, right? So if you can run to your guidelines for that section, I'm in the H's, which is the eyeball. So any eye guidelines I've got here. And then we'll have all the anatomy for the eyeball, and then we'll have all the common diseases for the eyeball. So if you can find your answers, this is your Google. Your Google is these books. So being familiar with your books, really knowing why they're put together the way they are, where everything is inside them, and getting to it fast enough when you're asked questions about it is all you need to do. Everything's listed in here. I'm that way too. Yeah. The link doesn't expire. Oh, yeah. You can go to Medical Coding by Jen, go to the resources tab, go to the social media tab, and the Discord link is right there. It does not expire. It's also listed in my TikTok bio, the number to add to get into our Discord room. I have the YouTube for $4.99. What does it cover? Everything. They all cover the same thing. It just depends on what you want to contribute to the content being created. Appreciate all of it, any of it that you guys do support. That's awesome. Thank you, thank you. And let's get the answer to this one. Every once in a while, I'll release stuff maybe a week or two earlier to some of the higher tiers, but no longer than that. Everybody gets access to everything. Just sometimes, if I remember, I'll can send like the latest workshop to the 14 a month people, and then I start feeling guilty about that, and then I'll switch it in a few days to everybody. I have way too much guilt about money to make anything worth a darn in this industry, but that's a whole nother situation. A is the answer for this one, that we would report this as a simple closure. What about this one, guys? At least all available answers are under admit or subsequent hospital visit. What is your patient's status? What does the physician consider the patient's status? Optum does not have it. Yes, you are at a bit of disadvantage if you're doing one of AAPC certifications and you do not utilize their AAPC ICD-10 book and HIPICS book. Their HIPICS books is over 800 pages long, comes with a ton of information for you guys. You don't have to buy them from AAPC. You can purchase them like from Amazon or anybody that will ship them to you for free. But their versions are superior. Yes. Only got 50 people on now on TikTok. That was nice for a little while. We had over 100. That was crazy. I haven't had that many in probably 6 months. That was fun. All right. I am going to sign up for your personal tutoring. That's awesome. That's great. I have two types of tutoring. One that is just like 40 bucks. If you just want to spend an hour with me and ask questions and let me, ADHD fever dream, right? And show you a bunch of stuff. Or if you are prepared and ready for your certification exam for around 80 bucks, I have one that I will prep a certification exam for you. You can do it in front of me, and then we'll see if you're ready for your certification exam. So I have those two options. And then I have Friday or Saturday pop up classes that are $6. that you guys can join, and we'll do 2 to 3 hours of practice exam questions. But it's a little different because we do them on Zoom, and you get sent the questions and you have to answer them inside Zoom without seeing what everybody else says the answer is in chat, which is really kind of cool. I don't know who answers what correctly or wrong or whatever, but I get like a poll result, like so many people said it was this one. So it's kind of cool. It keeps your privacy. You're not embarrassed about getting the wrong answer. And then I don't pick on you for getting the wrong answer, those kind of things. But it's cool because you're set alone by yourself and your computer and your books. And I give you 6 minutes for 3 questions. And that's how long you got to answer 3 questions. And then I stop the poll, and it gives you a real example of how fast you got to be on the exam day. So you know whether you've done enough to prepare or not. And for $6 for 3 hours, it's a really good class. You get the replay is good for 30 days on Zoom. And then I add it to my YouTubers as a replay that they can watch, but they can't get the benefit of getting the questions sent to them and doing them individually, but they get to watch the replay, which is always helpful because we go over the questions, show you why the right answer is right and why the wrongs are wrong. But those are fun. I don't have one up right now because I just had a family emergency, with Travis. So I'm still trying to wrap my head around all of that. I'm emotionally just distraught over all this still. I don't know. I seem to be handling it worse than Travi does, but I don't know. Kids are so resilient. Anyway, I'm just existing right now. I still haven't caught up on the week's worth of emails that you guys have sent me either, needing help, needing resend of links of can't find this isn't working. There's a ton of emails that I get daily, and having a week of me gone, not doing them, I'm still working on them. And nothing that Twinkle can help because it's always something that is like one of those things that I can't get this thing to work. Um, and it's something to do with my website or something, or I need to tell them how to um, adjust their system, and it's just more technical stuff. But anyway, or I would be using you, Twinkle. But anyway, I'm still behind on all those email requests and stuff. So hang with me. As soon as I feel like I'm not drowning anymore, I will start that class again. I was wondering if anybody wanted to do one on Thanksgiving week. I know y'all are with your family, but maybe we'll do another one Saturday, the 29th. I'm not going to get a workshop in, I know, for this month because of that emergency. I would have to do it this Sunday, the 23rd, and I have I have to go to Vegas again on Wednesday, and I have to go to Phoenix on Friday and Saturday. Um, and that's 5 hours one way. Vegas is 2 hours one way for medical appointments and things like that. So 3 days this week I'm going to be gone, and I teach Tuesday my class. So there's no way I can get another workshop in this month, unfortunately. But I will do my best to try to do a Saturday and a Sunday, maybe the 29th and the 30th. These Zoom classes, maybe we can do 2 of those instead of our workshop. But let me get through this week and then I'll put those up. I am just traumatized. Travis, fine, but I am traumatized. Oh, I cannot imagine from his point of view having something major like this happen to you to now think, okay, I'm so young, I'm 16. Now I gotta live like, and he doesn't care, he's fine. But I don't know, I'm worried. But anyway, you know how parents are. We're all worried. He's fine. I know he is. But dang, I hate him had to go through all that. My goodness. And one problem is He had delay of care that was really severely negligent to begin with. So we could have not had this issue if we didn't have that delay in care. He suffered for a week because of it. And that's pretty cruel, too, situation to look at. Anyway, where am I at? 15, 14. I'm at 14. Miss Smith. We got low decision making right here in the bottom of our sentence. Which one's low? Got B. Subsequent. This was our third visit to the hospital room. You know, absolutely, that would not be an admit code. You know, you cannot be A. And you know, you can't be moderate and you can't be high since we do have a low. So B is appropriate. I mean, literally, Travis cannot go to cheer practice and do anything today. But of course, where is he at? He's at cheer practice. He's just sitting there on the sidelines. I took him to school, wouldn't even let him ride the bus this morning. And then school had a late start today, which was 9 a.m., which was really nice. But he won't get home till 7 p.m. tonight. That is a long day. He has been a couch princess for 2 days since we've been home from the hospital. And I'm sitting here worried to death about him just sitting and being at school today and not doing anything. But I know he's fine. Hmm. He has a entire cheer team that will watch over him. They're worse helicopter moms than I am, so they're going to be fine. The replays of the boot camp has ads. I do. I sure do. I do. I love those classes. I wish I got the AAPC versions, but it was expensive. Yes, they are expensive. Hopefully, sometimes you can find a good deal at the end of the year for them and used. Thanks. Kids bounce backs. Yeah. My heart is still in mourning. He's like, eh, I'm glad to be out. Let me go back to school. Mm. Still still gifting memberships. What's that about? Yes, he loves his support team. His cheerleaders are just great. Hey MK, good to see you, love. I'll post those classes up on my website. They're not available right now, but I will post them as soon as I get off the live because I think we can do those. I think we can do those dates. Um, as soon as I get off the live, they'll be on my website at Medical Coding by Jen, right? And just go to the tutoring tab, and down at the bottom, there'll be a $6 class. I just don't have them available right now. It'll say nothing's available, but give me a few minutes, and as soon as we finish this live, I'll add that class. I think we should do one on the 29th and the 30th. That way, some people can do on a Saturday, some people can go on a Sunday, and I might even do the 28th, which is a Friday. That way we do all 3 days because I love those. Those are fun. Some people can do Fridays, some people can do Saturdays, and some people can only do Sundays. But some people have church on Mondays and Sundays, or Fridays and Sundays. So Saturdays are best. So I think instead of doing a workshop, 'cause there's no way I can prepare for that, um, we can do those. That'd be fun. But I'll add those to the tutoring tab as soon as we get off. What do you guys think about this wedge resection? What are we? Do you know where these codes are at? Can you even find them? Right? That's right, Marissa. Do you have practice exams other than the ones provided by AAPC? Yes. I have a ton of practice exams on my website. For $8, you get a membership, and I have thousands of practice questions on my website that are interactive that you do on my website that are exam questions that I wrote that you can do. There's also interactive anatomy where you move particular words to a body part. There's also patient charts where you add the correct words into the patient chart where it goes. It's kind of fun. Little thing we used to do in grade school, you know, add the right vocabulary term inside the paragraph where it goes, kind of like thing. There's a ton of little stuff there on my website included in that $8 membership, but um, super cool. Hopefully that is helpful. There are practice questions also for companies that I recommend, like Pocket Prep. If you go to my website, the main page, right on the main page, I have a pink pill that you guys can click on. Show you if you go to medicalcodingbygin.com, my little website right here. See the pink pill that's got Pocket Prep? Just click on that. They have 750 practice exam questions that are all part of like AAPC. They have even tell you where the answer is inside your manuals. So if you have the 2025 AMA CPT book right now, for those 750 questions, if it's a CPT question, it'll tell you where the page number, where the answer is. Oh my gosh, I learned so much from them. And if you do use my little link that's on my website, they do send me gifts that I can give out to you guys, which is super helpful. But I use them and have used them and have purchased an account for them since 2019. Legitimately use them. I love them. I think they're great. Um, One of the more recent ones that I added here was Exam Edge. They have 1,000 practice questions. Even they have some for CCS or CPC, even CPMA. They got another set. So each certification comes with their own 1,000 questions. They're short questions though, no page numbers where the answers are. And they're short questions like, what is the answer or what's the code for like an anterior total splenectomy or something or another, right? It's just one sentence, kind of like things. Every once in a while, they'll have a PDF chart that is a full question, full chart thing, but it's usually the last 5 questions out of 100 that are like real exam scenarios, right? But for the price, AAPC is $40 for access to all 750 questions if you get 3 months. Exam Edge is like $80 to get all 1,000 questions and you own them and you're done. No monthly payments. But anyway, I do, some of their questions are outdated on Exam Edge. They have outdated guidelines, outdated codes that have been deleted. But out of the 1,000, I'd say 25 of those are outdated questions, right? Most of them are okay. AAPC's pocket prep right here, none of them are outdated or deleted codes. I go through them every year. If I find any irregularities or if I disagree with their guideline and I think it's been updated, I'll contact them, and I've got a contact there, and they correct them. Or we banter back and forth. Me and the exam question writer, I can talk to them and find their reasoning out about why they wrote the question the way it is. So really like them. They're really scientific on the way they write their questions. So those are the two that I recommend. And of course, if there are any instructors out there that are teaching it, any CPC course from AAPC, they usually have some questions of some sort that they write and have out there available for people. I do have on my website at Medical Coding by Jen, right? You go to the menu page, drop down menu on the home page. There is a list of additional educators right there. You can do that. Don't forget about under the resources tab, there is a list of grants and stuff under the FAQs. You just go to the FAQs and there is a third sentence down. There is where do I find the best list of free resources? Click that, and there's everything from the CMS free courses to my free book prep videos, my free book prep pictures that I show you 8 pictures, tell you what to do in each of them so you can book prep your own books by yourself. Our Discord link is there. This is the CMS link for the free certification for the fraud and abuse, grievances and appeals, and stuff like that. There's a free scholarship from AAPC. There's a free scholarship for Pocket Prep too. There's a free grant list for Coding Clarified. Apparently, they paid for the license agreement for every state in the United States to sell a course per state so that they could get added to the grant information per state for like workers' comp or unemployment benefits. Like if you can get a grant to pay for an AAPC course, it's usually through unemployment benefits, right? And they've signed up their course to be available under unemployment from each state, which is a huge expense. I know for Arizona, it was $5,000 to sign my school up here in Arizona to get unemployment benefits so that people could use it to buy the AAPC course. If I went to every single state and did that, I don't even want to know what the price would be. But anyway, whew, it's a one-time fee and then it's just yearly maintenance fee, but still, it's an upfront fee. The monthly magazine is there. There's a ton of free resources on my website. This website is not to sell you things, it stores my information, where everything's at, right? How do you book prep? All that kind of stuff. It's all here. Free blog lessons, free job support, free practice exam question area. I even have that there. Free PDFs, free downloads. Lots of stuff here on my website for you guys to work with. Now, this question, did you guys find it on page 38? You did. When do we use 99368 for non-physician or more? There was some really cool ones we did during our Saturday course this week. Some of your telemedicine services have to happen within a certain time frame, which was really cool. We found one this weekend that people kept thinking was correct, like the 99446 for 5 to 10 minute telemedicine visit, but you can only use that code if they see a provider within 7 days of them being discharged from the hospital. Our patient did this telemedicine on the 10th day after they got discharged from the hospital. And because of that, you couldn't use this code. So it's really kind of cool. You've got a lot of different guidelines right before a set of codes that you need to know. Just running to the code and its descriptor won't tell you everything you need to know for some of these. So really kind of interesting. Very fun to do those classes. Where do we find the information to receive the magazine from the AAPC website? Everybody who's an AAPC member does get the magazine, but the magazine is mailed to your guys' email address, right? To get a paper mailed version to your home that's actually printed and that you get in your mailbox, you need to go to your AAPC account. You need to go to preferences underneath your AAPC account and uncheck a box that's automatically checked. It's the second one down that says the AAPC magazine can be sent electronically to your email address. If you uncheck it, then that means they will mail it to your house. I have a YouTube video showing off the screens and where to go for that. If I do it now, it shows off my mailing, my home address and all that stuff. So I don't want to go there right now, but I do have one already created on YouTube. Don't forget, there's an hourglass on YouTube, and you can go into my YouTube channel and you can click on that hourglass, the magnifying glass thingy, and you can type in anything you want to look at. Just type in the word magazine, and I'm sure that one will pop up. You can also call AAPC and make them uncheck it for you. Tell them that you want, during business hours, right? Tell them you want your magazine mailed to you physically in the mail. You don't want to look at it electronically. What does Practicode look like? Practicode looks like a claim form on one side of the screen, and then on the other side of the screen is a patient's chart record for that visit, right? A lot of outpatient visits, a lot of E&M visits, and a lot of radiology visits. So your job is to code them and key in everything into the claim form, right? You'll type in the primary diagnosis code, you'll tie that to a CPT code and modifiers, and then you'll submit the claim. And then it will tell you whether you're right or wrong. You need to get 70% correct to pass it. I cannot find the 3 R's in the 2026 book. It's on page 40, isn't it? I just saw it there. I'm sure it's somewhere else too in here, but for a second ago, if you're in the 2026 page 40, 41, sorry, 41, right here. Consultation is a request, right? Should be a report, right? That's just the first thing that I saw right there. So page 41, first column, there's a couple of mentions of having a request and a report. I need updates from 2024 to 2025. I can't find on CMS. What do you mean the updates? The updated codes? Why don't you just look at the AAPC Knowledge Center, right? You guys have so much available to you, even without an AAPC membership. So this one answer was C. Or the 6-7. Here's their next one. Let me see. What do I have here? This window. No, I can. Okay, let's see what it looks like. And let me move it up. Okay. So if you're on AAPC's website and you do training and events, where's it at? Resources. Go to the resources tab, and right there you'll see AAPC blog right there. And then it'll take you here to AAPC's Knowledge Center. In this top box at the very, very top, hold on. Transform, edit transform, top, runway. We'll go this way. There we go. Now you see the little top part right up here. If you go 2024, or even probably 2025 new codes, you should come up with a full blog of all the new codes that they brought in, right? So there's a blog. They'll tell you what the new code numbers are and what they mean, any guidelines that are involved about them, and then show you some examples. AAPC writes all this for free. You don't even need to be logged on. You could be just anybody on the internet. I'm sure they've already done a blog about the new 2026 codes, so you could type those in, and then you could look up, yep, AMA releases the 2026 codes. Now you've got a full list of all the new 2026 codes. Their blog is great, so, I'm not, and it's free. All this is free. If you ever wanted to know about how to code infusions or Moz surgeries, anything, type it all in there. And they have tons of cool blogs that they've written about stuff. So there's one about Moz surgeries, and these are great because they'll tell you and have like examples here of a certain patient. Like, for example, if we did this, this, and this, here's your answer. Love it. It's pretty cool. I like it when they write blogs. But don't forget about your AAPC Knowledge Center. Tons of free help in that. All right. Here's our next question. Yes, it was C. And I have a document that will turn any 2024 CPT book into a 2025. And I also already have a document up that will turn your 2025 book into a 2026. I have the 2026 Business of Medicine notes up and ready for you guys. And I also have all of the out of code sequencing so that you can just write the numbers down on the page numbers of where codes are at for 2026 and 2025 up in my shop if you guys need it. On my website, at Medical Coding by Jen, she was asking about jobs. If you just go to the free blog lessons right there, my last blog that I did is about stacking jobs right here. Oh no, it's about the top predictions of what's on the exam. Sorry, the one before it is stacking jobs. So just click on that, it's free. And I've got a list of a bunch of companies, how to find a job there, even if you're not a CPC. Like, you could go to Arrow Health right now And if you click on that, it is their company link, and just go to the careers page, and you could start doing remote work, helping customers get breathing treatment machines sent to their house, right? Motive Health, same thing. Bamboo Health, same thing. There's a ton of companies that are hiring for remote kind of side positions, right? You help customers text base. You could do just text messages. You could do just emails. You could even be doing just a list of customers that they send you each month, and they want to verify that their insurance is still covering their benefit, like their breathing treatment machine or whatever. Can it still be there? Can we bill? Is it going to be okay? Is their prior auth still working? And you just check to validate that their insurance is still valid for the next month. And then you check off the ones that are valid, and the ones that are not valid, you let your supervisors know on that list. There's a lot of different types of positions that you could do. Even my lab person could work remote in for LabCorp, doing more of a customer base or auditor situation. Um, just a ton of positions that you guys can get into that can transition into medical coding as you get certified. Hopefully medical auditing. All right. Are we admit and discharge with this code? Are we a consultation? Are we standby? What is our patient status? What do you guys think? MK wants to do spine work. There was, where's my thing at? I was taking down some names. Banner was hiring some remote positions. Washington University um, was hiring remote positions. Reserve.com, but it doesn't have the E at the end, just RESERV.com. Better Life Partners. All right, guys. Sorry about that. I got my computer wanted to reboot. Steam, which I'm streaming on for OBS, decided it wanted to update. But anyway, I think I'm just going to end this live here anyway, because I have to open up Word documents and all that stuff that crashed. And Travi will be here soon anyway, and I have been on for 2 hours. I already have the live up for the next live, which will be Monday, ready for you guys on TikTok and on YouTube. I will log on to my website and go on and post up the 3 classes that we'll do. I can't do Saturday. I can probably do a $6 class like thing on Sunday the 23rd. And then a couple of more on the 28th and 29th and the 30th. So I hope to see you guys during those lessons. We will practice exam questions then, and I'll see you guys again on the 24th for another free live lesson. Until then, during this week, what part that I'm home, I'm going to be working on 2026 notes. The first section that I'm going to do and finish is the male reproductive system, because it had the most updates this um, year. It hasn't had a new CPT code in, I know, 5 years. So it's been forever. I haven't had to update this system in forever. And now it's even got out of code sequence codes. It's never had those before. It was the one section in the CPT book that never had any out of code sequences. But now we got new codes. And so I've got to finish that section, and I'll get that posted for you guys, hopefully by the end of this week. And it's just one of the sections I'll update just because the codes have changed a little bit. They've got quite a few new ones. though. How many new ones did they get? They got 1, 2, 3, 4, 5, 6, 7, 8, 9. 9 new codes. And there's not a lot of codes in this section to begin with. 9, 10, 11. Yeah, 11 new codes. And there's probably less than 40 codes altogether in the section anyway. So it was a significant change. A lot of times there's no significant change in a section, like anesthesia hasn't had a new code in 5 or 6 years. It's just the same codes every year. There's no need in an update. So don't stress about my notes being a different year than what yearbook you have. The codes don't change in the AMA book. They just get added to every once in a while. And if there's a significant change, I'll add those codes to the end of those notes as the year goes by, or I'll redo the whole section. Just depends. But anyway, I hope this is super helpful, and hopefully I will see you guys again this Sunday for a little class if anybody wants to attend. If not, I'll see you on Monday the 24th. Thank you so much for tapping. Yes, 20,000 taps. That's awesome, guys. Thank you so much. Thank you for the YouTube too, guys. Oh, you're welcome, Claire. Thank you, thank you, thank you so much for being here for me, guys. And Travi too.